Good day, everyone. I am honored to share with you my research entitled The Study of Muslim Maguindanaoan Culture Basis for Culturally Congruent Nursing Education. I am Dr. Elmer Organia. This study is inspired by the theories Madeline Leininger in her theory Transcultural Nursing. For her, the application of transcultural nursing is essential, especially in transitioning into an increasingly multicultural society. Muslims are composed of around 1.8 billion people and are considered the second largest religion after Christianity. Because of this, the possibility of having encountered them is very high, and as a result, the way they are being dealt with may provide challenges, especially for those unfamiliar with their culture. According to Murunda 2019, student nurses coming from different cultures need caring and understanding, and this changing diversity among students brings in unique needs. This study was conducted to deepen the understanding among non-Muslims of the Islamic culture through Muslim Maguindanaoan student nurses' voices. This will also address issues of discrimination in a Catholic school. Specifically, this will ensure a conducive learning environment for minority student nurses provided by culturally competent faculty. The findings of the study were used as a framework to develop a culturally congruent nursing education for Muslim Maguindanaoan student nurses. This study used a qualitative phenomenological research design and was conducted in a Catholic institution. The setting is bounded in the north by the province of Maguindanao, where most Muslim student nurses reside. Pure Muslim Maguindanaoan student nurses were taken as participants and the data were analyzed using Colaci process of phenomenological data analysis. The results revealed five emergent themes. First, cultural practices and traditions of Muslim Maguindanaoan family. Second, experience of acceptance, respect, and supportive school community. Third, student organizations, social networks for relevant Islamic activities. Fourth, the curriculum and instructions with considerations of the Muslim Maguindanaoan culture. And the last emergent theme, a Catholic school delivers quality education while respecting the diversity of Muslim Maguindanaoan students. The sub-themes are also presented. The results revealed that the Maguindanaoan family is usually an extended family with strong connections. They also value being called Pai or Datu, respect for other cultures, modesty, generosity, and loyalty to Islam. They also believe in folk healers similar to different cultures. In terms of relationships, opposite and same-sex relationships are viewed differently by the participants. For some, it is acceptable, but not for others. In terms of marriage, the participants also have opposing views about early marriage, parental consent, and marrying while studying. For communication, it includes the preferred language in communicating, touch, and eye contact. Wearing of hijab and long dress is an obligation of Muslim Maguindanaoan women. However, school policies hinder them from practicing, especially during related learning experiences or RLE. They also developed strategies and requested that they wear the hijab during clinical and community exposures. The Muslim Maguindanaoan are prayerful and they would want to pray even they are in school. The participants are eager to pray, especially during Friday. The participants also experience great support from their classmates and instructors. They said that their classmates are allowing them to pray in the classroom without disturbing them. The instructors also excuse the Muslim Maguindanaoan students to pray if they have scheduled classes. The Muslim Maguindanaoan participants are conscious of the food they eat. They express the cultural restrictions, their experience eating with Christians, their experiences during fasting, the services in the school canteen, and considerations they receive from their classmates and instructors. The Muslim Maguindanaon students find a school home and experience acceptance, respect, and a supportive school community. However, some participants experienced isolated discrimination and felt being left out initially. The Muslim Student Organization conducts relevant Islamic activities and provides opportunities for Muslim students to organize. They also experience cultural considerations during school activities, where the Muslim culture is showcased in various institutional activities. They also emphasize that celebrating the Christmas party is forbidden for Islam, and they suggested activities to improve cultural awareness in school. The participants value quality education offered in a Catholic school. In their clinical exposures, the Muslim Maguindanaon has different opinions about assisting in culturally restricted surgeries. They also value the elderly and willing to understand patients despite differences in culture and beliefs. During lecture classes, they also express several reactions to the discussion of sensitive topics in class. They also emphasize that some subjects integrate topics about Muslim culture and their instructors provide considerations to them and expressing fair treatment. The results of the study serve as basis of four outputs or frameworks. The first output is the culturally congruent nursing education model. This model is a visual guide that depicts a Muslim Maguindanaon student nurse's experiences in a Catholic school. The student nurses carry their cultural identity before they enroll in a Catholic institution. Meanwhile, the school has its own identity through its mission and vision that needs to be maintained and achieved while responding to the students' diverse cultural needs. As a result, the Muslim Maguindanaon students experience challenges related to their cultural beliefs and practices. This model is inspired by Leininger's Sunrise Enabler. This culturally congruent nursing education model is designed to deliver culturally congruent nursing education for student nurses through the mapping of the program outcomes, prototype curriculum, educator's guide, and relevant programs and activities. This model can provide quality nursing education with careful considerations of the Muslim Maguindanaon culture. The five emergent themes that evolved from this study are now considered essential factors in this framework in delivering culturally congruent nursing education. The second output is the BSN prototype curriculum integrating Islamic study subjects and transcultural nursing. The following subjects can be included in the curriculum as a replacement for the religious education subjects. We have history of Islam, life and teachings of Prophet Muhammad, Islam morality and responsible parenthood, religions of the world with peace education, and transcultural nursing. The third output is the integration of culturally congruent nursing education in the curriculum map. And lastly, the fourth output is the Educator's Guide for Muslim Maguindanaon students. This guide aims to help educators be aware and responsive to specific accommodations for Muslim Maguindanaon students in practicing their values and beliefs. Based on the findings of the study, it is recommended that the school administration should intensify the use of the framework for culturally congruent nursing education. The nursing faculties shall review the curriculum to strengthen their capacity to respond to culturally diverse students' needs, and the Commission on Higher Education may encourage schools to integrate transcultural nursing subject to respond to the needs of Muslim Maguindanaon students. In nursing education, nursing schools may use innovative approaches to provide a culturally responsive environment. In nursing practice, nurse practitioners will respect the diverse culture of the student nurses, and in nursing research, more intensive studies on instructors' experiences in responding to diverse students' cultural needs should be done. Thank you and good day once again.